Hey, Future Medics, Tina here, your medic mentor. And today we're talking about a medication that's kind of like Cardizem's cousin. It's Verapamil. And the brand names that you'll see are Isoptin or Calin. Now, Verapamil is also a calcium channel blocker, which means it slows that electrical conductivity through the AV node, which will lower heart rate and contractility of the heart. It's useful for our stable patients with SVT or AFib RVR. It's especially helpful when adenosine did not help or vagal maneuvers are not helping and we need to slow down that rate. Now let's talk dose. This one also has two different dosing models. So for the first, you're going to do 2.5 up to 5 milligrams slow IV push. Make sure you're pushing that over about 2 minutes. So we're going to do a nice slow IV push with this one. And then if that does not work in 15 to 30 minutes, you could give a second dose. The second dose is different than the initial dose. The second dose is 5 to 10 milligrams slow IV push, still slow, and you can repeat that as needed every 15 to 30 minutes up to a max accumulation dose of 20 milligrams. So that looks a lot different than Cardizem did. Now the onset for this one is 1 to 5 minutes, so pretty fast. So absolutely, if that hasn't taken effect in 15 minutes, it's probably not going to. You need to try a higher dose or try another dose. And the duration on this one is a little shorter than Cardizem at 30 to 60 minutes. So if you did give the dose and it started working, but in 30 minutes it has worn off, realize that's part of its duration. It's kind of short, so you're going to probably need to give another dose of this one. So keep an eye on that. Looking at the side effects and the contraindications, though, looks a lot the same as Cardizem. So for side effects, we're going to see that hypotension, bradycardia, maybe some nausea, dizziness, and fatigue because we're lowering that blood pressure and that heart rate. Contraindications also look a lot alike. Wolff Parkinson White is a problem. It is still a problem with this one. So just like with Cardizem, we didn't give it to them because it can send them into a lethal rhythm. This is the same classification of medication. So it's going to be very dangerous for Wolff Parkinson White. So make sure you ask before you give this. Also contraindicated in high degree heart blocks, sick sinus syndrome, cardiogenic shock, anyone who's already hypotensive. So from Cardizem to Verapamil, those look a lot the same. Here's your takeaway. Verapamil is an effective backup for rate control of those narrow complex tachycardias behind adenosine, especially if that doesn't work. But you've got to be solid on your rhythm interpretation and your patient questioning to make sure that we're not going to hurt them. Also, keep a very close eye on that blood pressure. But other than that, you're good. You've got another one knocked out. You're doing such a great job. I'll see you for the next one.